Welcome back, listeners. Get ready for another enlightening episode as we go deeper into our sexual health and well-being on the topic, the Untold Truths and Stories about Genitals, where we're focusing on human papillomavirus, aka HPV, and cervical cancer connection. Now, in the previous episode, we talked about the genitals, how it is misunderstood. We introduced HPV. But in this next episode, we'll be exploring HPV and its connection to cervical cancer. We'll go deeper. I remain your host, Uchenna Amadi, and I'm still with the incredible health professional, Dr. Habeebu, the Chief Clinical Coordinator of NSIA LUTH Cancer Center. Please do not forget to like, subscribe, share, and follow SYNLAB Nigeria on YouTube and Spotify. Now over to you, Dr. Habeebu. Can you explain how HPV is transmitted and the different types of HPV?
HPV is actually a sexually transmitted disease.
Yes.
So it's transmitted through coitus. That's contact. There are many subtypes, but the most important ones are the subtypes 16 and 18, which are really the ones that are involved in cervical cancer, causative. So in transfer of is by coitus and different type of sex, even oral sex and all that can also help in transferring HPV.
That's strange. I even read where it says that nearly 80% of people will contract it in their lifetime. Is that true?
More than 80% will contract it. And also more than 90% of those who have cervical cancer has it. So it has been really linked as the cause. It's the only cancer that we say is contagious. Cancer is not contagious normally, but cervical cancer is contagious because you can transfer through HPV.
Okay, but this HPV, is it possible that in some cases they clear on their own?
Yes, it's very possible that they clear on their own. Not everybody that has HPV that eventually become a cancer patient. But a good number of cancer patients are as a result of HPV.
Okay.
Not the other way. Yes. Otherwise, everybody would have collected. Would have had,
Yes. Okay, so what are the associated risk factors?
Yes, risk factors are anything that will increase the length of, the HPV infection, that will allow early contact. For example, multiple sexual partners and multiple partners of sexual partners. Then early contact.
It's a ripple effect.
It's a ripple effect because if you have a partner that is mixing with, that's having contact with other 10 other people, you are inadvertently having contact with all those people.
Yeah, on the top list of getting it. Yes.
So, and then anything that will reduce immunity.
Okay.
Because when the immunity is reduced, then it gives the human papillomavirus ability to encroach. So, for example, we associate with the HIV or AIDS, which also is a disease that affects the immunity. Then chronic starvation will also, cause that. Anything that malnutrition, all that will improve the, chance of having it.
So
then early coitus. That's a person that starts having... It's not of
age.
Yeah, it's not of age. The immunity may not be that strong and is already having, sex. Then alcohol and cigarette smoking has also been associated with cervical cancer because they have, agents that are usually will cause continuous irritation to the cervix too. And instrumentation. That's when you use instrument to deliver a baby through the vagina. And it is also irritating the vagina. Multiple childbirth has also been associated. So women that have multiple children, because you have multiple, that means many times you are delivering, you are forcing through the cervix. So anything that forces, that causes, then recurrent STDs. A woman that is having multiple sexually transmitted disease is more likely to also have HPV. You understand? Because HPV is also a sexually transmitted disease. So anything that will increase the chance of chronic irritation which human papilloma virus causes will also increase, then also abnormal genitalia. The women that have abnormal genitals, they have high likelihood of having cervical cancer too. And, then other infection, like I said, other, form of bacterial infection will also increase the risk of having human papilloma virus. And what will reduce the risk? What will reduce the risk is keeping to a single sexual partner, both of you being faithful.
Yes.
That is one. Using a barrier when they meet, like condoms, and then also doing having vaccination at a younger age before starting coitus. The people would have been immunized, with vaccine that are against human papilloma virus. Then even if you've started going for checks,
regular checks, yes.
Then having vaccine if you don't have the virus already in you. This will also help to prevent,
wow,
HPV.
That's very extensive. Yeah. So let's shift a bit to the symptoms.
Yeah.
So what are the symptoms and how is it diagnosed?
Okay, HPV itself may not present with any symptoms.
That's scary.
Yes, but when it has developed to cervical cancer, then we can start having symptoms. Yeah, one of the commonest symptoms of cervical cancer is postmenopausal bleeding per vagina. So somebody that has already attained menopause maybe suddenly 2, 3, 4, 5 years later, starts seeing blood again. Most of the time, this is a sign of cervical cancer, but it needs to be investigated.
Yes.
So that because there are a few other reasons why a woman that is postmenopausal can start menstruating again. Then postcoital bleeding, that's after coitus, the woman starts seeing blood. Intermenstrual bleeding, pelvic pain, that's a pain around the lower abdomen. There are other symptoms like chronic discharge. Chronic discharge. The discharge could be fluid, it could be serosanguinous. Serosanguinous may mix with blood. Yeah, it could be blood. This discharge continues. It may become offensive if it is not treated.
Yes.
That's offensive treated discharge. You see the person keep going to buy antibiotics and repeating if it's not properly investigated. And at times, it may even lead to what we call VVF. VVF is vesicovaginal fistula. That means the cancer can eat up the vaginal wall up to the cervix. The cervical wall up to the bladder. In which case, it will not be able to control urine. It could also cause rectovaginal fistula, that's eating posteriorly up to the rectum. The rectum is a pathway of feces. So the person will start having feces coming out uncontrollably from the vagina. So we can have all this, and we can have other symptoms depending on where the cancer spreads to the lungs, to the abdomen. And usually such a person would lose weight because the cancer burden will be marked. So the person will lose weight and it will be sickly, chronically ill-looking. At this stage, this advanced stage is what we call stage 4. And because, stage talks about how far
it has gone.
So from stage 1, it can get to stage 4 when it has spread.
Sir.
If it is not checked.
So for the diagnosis, so what are the tests that we can do?
For diagnosis, we can take a sample. We could do a pap smear if we are screening.
Pap smear.
Screening, that's for screening. But for diagnosis, you have to take a sample. The person will have to present at a laboratory or the hospital where they will take a sample from the cervix and send to the lab. And you want to see the type of cell in that cervix. There are some characteristics of the cells that may make us, determine that, this cells is now cancerous. Say, for example, you will see that the cell inclusion, that's the chromosomes and all that, they will be magnified compared to the cytoplasm. And the cell may change, may become more primitive. You may not be able to see any of those things, in which we are talking now about grade. Grade is aggressiveness. We have some type of cervical cancer that are very aggressive, and we have those that are mild, or you say indolent, depending on how aggressive it is. We can also know this from the laboratory.
Yeah. Wow. This has been very enlightening and eye-opening. So to my listeners out there, having heard all this, please stay informed and stay safe. You can walk up to any location, any SYNLAB location, and do or request for our peachy panels, which is our anonymous STI testing, and also request for your LBC to be done for your cervical cancer screening. Please do not forget to like, share, follow, subscribe SYNLAB Nigeria on YouTube and on Spotify. Please don't go away. We'll be back shortly.